I grew up in a really small farming community in Canada where coming to see a specialist like me
Sure.
just isn't available, right? You have to drive an hour or two to see a urologist. I write for the guy in the tractor at midnight in the field, or the guy sitting in Omaha, Nebraska at the airport lounge, coming home from a sales trip, where maybe
Yes.
they don't have access
Yeah.
to a specialist and all they're getting is emails, or they're scrolling through TikTok and Instagram, texts from their best friend Joe. And I always say, well, is Joe really the expert?
Yeah, is Joe really the expert?
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Well, hello, hello, hello. Hi,
Hello.
everyone. Welcome again to the Care Room with Dr. Cindy. Today, I have an amazing guest with me. It's Dr. James Kuan. He is joining us all the way from Seattle, Washington. And he is this amazing urologist. He's an amazing medical director. He is a life coach. He is the awesome author of this, and I bet once he tells you the name of it, awesome newsletter that helps so many people. And it answers a lot of questions that, a lot of male patients have. I know our podcasts are typically geared towards female patients, but this week we're bringing you an episode for you ladies. It's to help the men that you love, the men in your life. And for you guys, it's to help you. So Dr. Cindy has not forgotten you, okay? But before we delve into things, I'm just going to let Dr. Kuan introduce himself. All yours, Dr. Kuan.
Well, thank you, Dr. Cindy, for having me.
Absolutely.
I am a urologist, a coach, and the creator of the Sex After Retirement newsletter.
You guys heard that.
And sexafterretirement.com. And we developed that name as let's just use that as the starting point. And my colleague who does all the email newsletter stuff, he says, no, that's the name,
I love it.
because that's what it is. And I think more kind of expanding that, 40% of our readers are women, so these are partners. I take that as a win for me, because these are topics that are not just about men. And we know, and the data show, that men are taken care of by their partners and the women in their lives. And so I think
The
being an
men too,
informed,
right? And sometimes men in their lives as well, right?
absolutely, all
Yes.
partners, we all have, well, not all, but most of us have that other person
Yeah.
who, when we let them take care of us, may actually be doing something good for us. So the newsletter Sex After Retirement seems very focused, but a lot of what we talk about is men's health, sexual health and dysfunction, recovery after prostate cancer, erectile dysfunction being one of those things, male incontinence. We cover things like prostate enlargement, prostate cancer screening, but then also we cover that phase of life that is your 50s, 60s, 70s, which, whether you're male, female, or otherwise, usually represents some transition. All of us will transition, whether it's women going through menopause or men going through retirement or empty nest. And where does that leave us as men? Where does that leave us in our relationships with our partners? And where does that leave the partnership? Because I think I grew up in a really small farming community in Canada where coming to see a specialist like me
Sure.
just isn't available, right? You have to drive an hour or two to see a urologist. And so I write for the guy in the tractor at midnight in the field, or the guy sitting in Omaha, Nebraska at the airport lounge, coming home from a sales trip where maybe
Yes.
they don't have access
Yeah.
to a specialist and all they're getting is emails that might be junk mails or sales pitches, or they're scrolling through TikTok and Instagram. Or one of the things we talk about, they're getting texts from their best friend Joe. And I always say, well, is Joe really the expert?
Yeah, is Joe really the expert?
Unless he's a urologist, maybe he is.
Maybe he is. So, Dr. Kwan, one of the questions, it's so common, like I did, when I worked as an employed physician for a hospital system, I used to get a lot of questions, especially from women who can't get the men in. They cannot, for whatever reason, get them in, but they wanted to help them. And one of the questions a lot of the times was, oh, he's spending a lot more time in the bathroom. It takes him longer to pee.
Hmm.
And, can you tell us more about that? Like, where would you go
Yeah.
with that? Yeah.
Yeah. So men have prostates, women do not have prostates, and our prostates sit below our bladder, and urine has to pass through the prostate, through the urethra en route to the toilet. Starting in our 30s and 40s, our prostates start to grow. And they continue to grow till the day we die. And really, what happens is as that prostate grows, you get more and more constriction. And that does two things. It causes higher pressure. So a bladder that has to work harder to express the urine gets more muscular and less flexible. The guy at the gym who's really muscular is usually not that flexible. So with a little bit of urine in the bladder, so while you asked me about taking a long time, they may also have to go many times. So frequency and urgency, we call those the irritative symptoms. And often many of those patients, if you ask them, does he get up at night? Getting up at night to pee one or two times becomes part of the equation, is often the first symptom. But you can imagine as you start to obstruct, the flow slows. And so it takes longer to empty the 2 cups from your bladder than it does if the channel is more open. And so we call those the obstructive symptoms. And sort of in the short term, it's frequency, urgency, getting up at night, slow stream that stops and starts, and dribbling at the end. Longer term, it can lead to infection, difficulty urinating, maybe even needing a catheter. And in very uncommon, but not infrequent scenarios, the bladder pressure can get so high because they're retaining that it can affect kidney function. And so for that guy, just because it takes him a while doesn't mean he needs to have treatment.
Okay.
I always say, how much is it bothering you?
Okay.
If it's not bothering you and you're not having an infection and
Sure.
you don't need a catheter and you're not leaking, then it's really just a lifestyle thing. But I think that it's important, though, when those symptoms are present, for us to at least consider that, well, prostate enlargement is the usual cause. Sometimes it can be things more sinister like prostate cancer. Fortunately, prostate cancer presents, without symptoms usually, and rarely does it cause urinary symptoms. But when it does, it's really important that we diagnose it at that point. And
Sure.
so I look at those urinary symptoms as a potential knock, knock, knock. It's time we just go ask some questions and make sure that it is something that is okay to do nothing about.
Sure.
But that said, there's very easy and straightforward things that we can do also to help those symptoms.
Sure. So when you say knock, 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 is that like getting a PSA, a prostate, antigen level, or
I think to your first question, the knock, knock, knock is it's time to go to the doc and
doctor?
just
Okay.
ask the question, right?
Okay.
And then just say, this is what's been happening.
Sure.
I'm probably in my late 40s or older. And I agree. It is at that point where we should start talking about PSA, the screening test for prostate cancer, just as an opening part of the discussion.
Sure. Sure. And for those guys who are, I'm taking longer, but I'm not really bothered by it. When should they become bothered by it? Or when should it become a problem that the wife has to physically drag him into the office?
Well, I think if it's drip, 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 and it's 5 minutes, that's somebody who's really obstructed and they're probably retaining.
Okay.
think I think if somebody is in between urinating, not going, they're going twice a day. But when they move or shift in bed, they leak some urine. They may already have a full bladder and we're squeezing on that. I think where there's burning or where there's blood, um, or I'll even take it a step where there's a family history of prostate cancer, a family history of prostate issues, or someone's getting a fever that's unexplained. If you don't flush the bladder, the bacteria that normally occur there can percolate and percolate to levels where you get a urinary tract infection. UTIs are common in women at many ages. They're less common in men. And if somebody is in their 50s or 60s, a male, it's usually prostate enlargement. And so I think that, the women listening, if your guy is having urinary issues, even if they're not bothering, it's like, this is that chance for you to kind of say, let's make the appointment. Let's go together. Let's have lunch after, make an outing of it. Because we know that guys medically distance themselves, and we know that COVID made that worse. And I think we're still playing catch up with some of that medical distancing that happened.
Yeah. Yeah. Thank you for that. I love that suggestion of, making an outing of it. Because I think a lot of them, a lot of the guys are really just, scared. Scared to go in and, probably be told that, something is really, really wrong. So can you, if there is a problem, can you help shed some light on like the options? So I know there are certain medications, like Flomax that, we put them on, or there are certain surgeries, like a TERP that can be
Hmm.
done. Can you shed some light before we go into, like the prostate cancer discussion?
Sure. I think with any condition that affects our quality of life, we always say, well, what are the lifestyle things that we can do?
Sure.
You know, if you get up a lot at nighttime, minimizing fluids a few hours before bedtime, minimizing caffeine throughout the day if frequency and urgency are a problem. I also think it's important that sometimes that guy who gets up 2 times at night, it may not actually be his prostate, and he may actually benefit from a sleep study. If someone is sleeping poorly, they may not open their eyes every time they wake up, and we use sleep apnea as that very common example where they're in a light sleep and then the brain feels a little bit of urine in their bladder. If they were in a deep sleep, they'd stay sleeping. But because they're in a light sleep, plus that sensation of urine in their bladder, all of a sudden they wake up and they go to the urine. And so I think it's important to talk about sleep when getting up at night is a problem, and timed voiding, knowing that before you get in the car to drive 2 or 3 hours for Thanksgiving at the family's,
Right.
empty the bladder, things like that. When lifestyle changes aren't improving things, you're right. An evaluation, not always with the urologist. A lot of this happens with the primary care. And I think that's part of the hurdle too. Lots of guys think that, oh, if I have these symptoms, I have to see a urologist. You may end up there, but in primary care, lots of the initial stuff can be taken care of, making sure you don't have an infection. Doing the screening blood test, the PSA, to make sure that prostate cancer is not the issue. And assuming it isn't, you're right. Medications like Flomax, I always call Flomax the workhorse of urology. It's been around for 30 years,
Yeah.
and it's probably the most prescribed drug that we have. It's part of a group of medicines called alpha blockers, and alpha references an adrenaline type receptor. And in the capsule of the prostate, there are adrenaline receptors. And so when you block that receptor, instead of it squeezing, it relaxes. And that raises the point. You don't necessarily have to have a big prostate to have prostate-like symptoms. You can have a tight or tense prostate. And so some guys, when they have to urinate in public, it's called T-shy. It's often because they've got more adrenaline in their prostate capsule
I
squeezing
see.
and their bladder
Okay.
neck is squeezing.
Okay.
Something like Flomax kind of relaxes that. The other thing I tell people is count backwards from 100 by 7,
Seven.
because they actually have to think about
Think
that.
about
And
it.
then and then they can urinate. And that might be one of those lifestyle things. If it's hard to pee or hard to start, count backwards at the toilet. But these medications are safe. They've been around for decades, and they're the first line, and they will take care of 80 to 85% of men's symptoms. So this is something that in primary care you can do very easily. And so for your listeners, say, well, hey, there's this group of medicines, and there's about 3 or 4 that we use commonly, taken once a day, can almost overnight or within at least a week or 2 take care of frequency, urgency, improve flow, improve the sensation of emptying. Now, not all medications are completely free of side effects, but the reason Flomax is the workhorse is it actually has very side effects in very few men. Stuffed up nose, lightheadedness when you get out of a chair. So that's called orthostatic hypotension. There's also the adrenaline receptors in our blood vessels. And if we're blocking them, some guys will get 1 to 2 seconds of woozy when they get out of the chair. What I tell men is in the first few days, it may be mild. And if it's mild, it's usually going to get better.
Sure.
But rarely, if it's severe, I say stop it. And I've actually had someone fall the first night and break his cheek.
Oh.
That's not a cautionary tale to say, oh, everyone's going to fall and have a face injury. But it's to say that just be aware of that. And then there's one other side effect that kind of freaks men out that is important for us to mention. Unfortunately, it's sometimes a reason guys don't take the medicine, but it's called retrograde ejaculation. So when we relax the prostate, we also change the dynamics of orgasm and ejaculation because the prostate makes semen. So when men climax, that's where the fluid comes from, or most of the fluid comes from there.
Yeah.
About 80 to 85% of men will still, when they climax, they'll have less fluid or no fluid.
Yeah.
Orgasm will still feel the same.
Right.
They'll still have the pleasure and the sensation. But if we don't tell men about that, it kind of freaks them out when it happens.
Got it. Okay. All right.
There's other ways to shrink the prostate. Men with bigger prostates and symptoms will use medicines to shrink the prostate. These are also medicines that help men keep their hair.
Sure.
And then failing response to those medicines, that's where we want to make sure that someone's not retaining with a bladder scan, maybe doing a scope, to then get into discussions where the 10 to 15% of men who don't respond to medicines may need a procedure as you suggested. And then what we see on the scope is really that entry point for us to say, which of these options is now available?
Got it. Got it. Oh my gosh. Thank you so much. I have to bring you back, Dr. Kuan. This
Okay.
is so good because I feel like there are so many different avenues we could go with this. And, talking
Yeah.
about prostate cancer and your newsletter and, like dealing with life after your prostate cancer. But this was so good. Thank you for your time today. Can you tell
Yes.
us, where we can find this newsletter, this spicy newsletter?
Well, maybe I should make it more spicy, but there's still that contained. I'm not ready to go flashy yet. But you can sign up for my newsletter at www.sexafterretirement.com. Placing your email there, you'll then get the welcome, and we ask that you reply yes so that it doesn't drop to your junk. I'm also intermittently and occasionally on Instagram, and it's at DrJamesKuan at Dr. James Kuan. There's nothing there that's too spicy that you have to worry that it's not safe for work. I think you can still read my newsletter at work.
At work. Okay.
Because I'm trying to talk to everybody, the
Right.
men who need to hear good information and the people who take care of them.
Absolutely. Thank you, Dr. Kuan. Thank you for your
Thank
service.
you.
Thank you for all that you do.
And thank you for all that you do.
Thank you. We are going to bring you back because
Please.
I think what you do is just so valuable, as all of us in the medical field. But guys, you heard it. You know where to find him. Go look him up. Next week, I will have another awesome doc, just as awesome as Dr. Kuan, here with us. But until then, take care.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always consult your personalized healthcare provider for medical guidance.